My current role is Care and Health Manager at WDH. So my role is all around making sure that our relationship with Swift, where the clinicians are based, are well integrated with the team, making sure that the contractual side of things is all in place, and making sure that the commission is delivering not just for Swift and their organisation and the ICB, but also for us here at WDH in terms of keeping our tenants safe, and then putting the services and process and procedures in place to get that model embedded and ultimately support our housing colleagues who are dealing with quite challenging and emotive issues day in, day out on our estates, from the commissioners at Wakefield ICB all the way to those that we work with at South West Yorkshire Partnership, NHS Trust, making sure that everything's in place, and making sure that that the commission is doing exactly what it says on the tin, and that we make sure that it's meeting the needs of our customer base. It's really important for us as an organisation. Our strategic objectives are to be a landlord of choice, be a partner of choice, and by having the Mental Health Navigator scheme within our mainstream housing services as part of our offer, it really just enforces and reinforces the securing of our vision. So that's to create confident communities. We've got best part of 32,000 properties in Wakefield. If we go on quick maths, 1 in 4 is a mental health issue. That's potentially 7,500 properties more behind our very doors. So it's about making sure that those people have got the coping mechanisms and strategies that they need to maintain independence and, ultimately give us that tenancy sustainment, what they need as customers, but also that we require as an organisation. I think the impact for us customers is really amazing, to be honest. We deal with a lot of emotive issues. We work in communities where there is poverty and deprivation, but the impact to those people having a service at the disposal in a matter of weeks, it's about early intervention. It ticks every box in terms of that and giving that tenancy sustainment, but also allowing the customers to have a relationship with a person that they can call on, not just from an enforcement, but from a proactive lens. And I think that's really, really powerful, and it really helps to sustain them tenancies. And like I say, that's something that we're all about in WDH. In terms of outcomes for us and I suppose some of the successes, so the Mental Health Navigator scheme got recognition in the Resolve Awards for innovative approach to antisocial behaviour. So that's a massive coup and testament to the power of that commission and service. But just by having that reassurance across our neighbourhoods and frontline teams that we have got clinicians, not just housing professionals helping in a mental health space, but actual clinicians from whatever discipline or background they are from, whether that be social worker or occupational therapist, but they've got that mental health background, that qualification, and ultimately it just gives that reassurance to that customer that they are dealing with a trained clinical professional, and it just gives that different boundary from a housing perspective. So yes, the work within the housing team, they are a clinician and a professional from their own respective organisation, and I think by having that boundary, it just helps allow those relationships to develop and blossom, for people to get that trust and rapport that they need to get the best out of that service, really. I think the Mental Health Navigator scheme is really amazing. I think it does wonderful things for our customers. It's fantastic in terms of from a business perspective, and from us being able to offer that customer that service from a trained professional, a clinician, and ultimately it's testament to the partners and everyone involved. And hopefully we can just continue to build on that, really, and continue to make a difference to the people that we serve in our communities.